All right, hello everyone. This video is the start of my review and supplement series for Module 2B, which covers Chapter 6 of your textbook, which discusses long-term memory. Okay, so when we think about long-term memory, long-term memory is what most people are talking about when they think about memory. And basically, anything outside of the confines of short-term memory can be considered long-term memory. So anything that has occurred that hasn't occurred in the last 30 seconds or that isn't currently being rehearsed is going to reside in your long-term memory, right? So you might imagine before turning on this video, maybe you sat down and opened up your laptop and pressed play, okay? Those would all be, your memory for those experiences would all still reside in your short-term memory, okay? But anything that has occurred later than that would reside in your long-term memory. Okay, so that can be something as recent as 5 minutes ago. Maybe you were fixing yourself a snack or going through the chapter in the textbook, all the way to 10 plus years ago, right? But obviously, as we can very clearly discern, right, more recent long-term memories are going to have a lot more richness and detail to them than memories for 10 plus years ago, right? And so one of the things that your chapter actually talks about is how long-term memories change, right? So our recent memories have essentially two components to them, right? In one sense, they have general knowledge associated with them, right? So all of you should know by now that cognitive psychology is the science of the mind, right? So that fact in and of itself, divorced from any sort of context or episode, is considered a semantic memory, right? But if you were to recall not only that definition, but where you were when you read it in the textbook, maybe what you were wearing, where you were sitting, what you were thinking about, what you had for dinner that day, okay, that would be an episodic memory because not only do you have access to the knowledge itself, but you can also indicate the time and place in which you acquired that information. And what we see over time is that as there is more distance between when something first occurred and when we try to recall it, okay, we retain those semantic qualities or the general knowledge or fact-like qualities, but we lose a lot of the detail and richness of the memory that allows us to recall the particular episode in which it occurred, right? But those are all, both semantic memories and episodic memories reside within our long-term memory. Okay, so I've already distinguished between two different types of long-term memories so far. So I've talked about episodic memories, which include not just events and experiences, but knowledge about the particular time and place you were in when those events or experiences occurred, or you acquired the information, as opposed to semantic memories, which are simply general knowledge or facts about the world that don't include any sort of episodic component. But for most of the video, this particular video, I'm going to be talking about another distinction we can make in long-term memory, which is the distinction between explicit and implicit memories. So I have a nice little diagram here to help us talk about this distinction. So at the top in the yellow box, I have memory processing, or just long-term memory would be another placeholder there. And let's start with the right side of the screen where those pink boxes are. So one way to get information into long-term memory is to engage in what's called effortful processing. So effortful processing can include things like studying, thinking, rehearsing, basically any overt action that you would take or intentional action you would take to try to get information into long-term memory. So it's basically intentional attempts to consciously remember something, right? So explicit memories, or declarative memories as they're sometimes called, are memories for either facts and general knowledge, which are, like I said, semantic memories, or personally experienced events that include some kind of conscious recall. Okay, so you deliberately attempted to get the information into your memory system. Okay, and explicit memories are processed in a region of the temporal lobe called the hippocampus, and also the frontal lobes. Okay, so those are explicit memories, but we also have long-term memories that are acquired automatically or without conscious effort on our part. So we don't have to engage in any sort of explicit strategy to retain that information. It's just retained automatically. Okay. So when memories are acquired automatically, we call them implicit memories or non-declarative memories, because we didn't engage in any sort of deliberate encoding process or process of getting the information into memory. And we also can't sort of consciously recall how the information got there, right? So for example, your memory for riding a bike, right? It's very, very hard to verbalize how you learned how to ride a bike. And it's also one of those things that you can not ride a bike for 20 years and basically jump back on one, and it's like you never stopped, right? So it's something that it's almost as if your body knows something that your mind doesn't, right? So implicit or automatic memories are processed in the cerebellum and the basal ganglia. So right away you might notice that we have an example of something called a double dissociation. Right? So a double dissociation occurs when damage to one part of the brain causes function A to be absent while function B is present, and damage to another area causes function B to be absent while function A is present. Right? So another way of saying that, right, is that someone can sustain damage to their hippocampus or their frontal lobes, right? And this means that they're no longer able to acquire memories through effortful processing. However, they can still acquire implicit memories because their basal ganglia and cerebellums are intact, right? And vice versa. If you acquire an injury to the cerebellum and the basal ganglia, right, you're unable to engage in that kind of automatic processing of memories, but you're able to engage in effortful processing and acquire explicit memories, right? So real quick, let's go back to our little diagram for a second and talk about the types of memories that are explicit and implicit. So like I said, explicit memories are episodic and semantic memories, and they can be knowledge about events and experiences in your life, or autobiographical memories. And they can also be facts and general knowledge about the world. Both of those are considered explicit memories. And again, they're explicit because you engaged in effortful processing, and you can also consciously recall those events. Implicit memories are acquired automatically, and examples might be things like your knowledge of space and time, right? So your knowledge, your general sense of what time it is in any given day, or the general spatial layout of a room that you've been to before, right? So you know that information, you've acquired that information, but you haven't acquired it through any sort of effortful process. You haven't had to learn that information or exert any effort to acquire that information. You just sort of know, right? And similarly with implicit memories, we have things like classically conditioned associations, right? So a classically conditioned association is when we associate two different stimuli because they occurred together in time, or they occurred one right after the other, right? So we have Pavlov's dog and the little Albert study and everything that we talked about during Module 1. But another example might be associating a particular scent with a particular person, right? So for example, maybe every single time you smell chocolate chip cookies, you think of your grandmother, because every time you would visit your grandmother, she would bake you your favorite cookies, right? So again, that's information that you've acquired as a result of frequently visiting your grandmother and frequently eating her cookies, right? But it's not something that you had to sit down and consciously think about and study in order to remember it. Okay, so one of the best sources of information that we have as memory scientists, particularly when we have these double dissociations, right, is if we want to find out how memory works, or if we want to find out the neural substrates of memory, one of the best things we can do is study individuals who have amnesia or some type of memory-related impairment. And we can either look at, typically we can look at what's going on in their brain. So if they've damaged any particular structure, okay, that will tell us maybe that structure is implicated in whatever memory process is no longer functioning, okay? So typically when we study amnesia in individuals, we can distinguish between two different types. So there's retrograde amnesia, which refers to an inability to retrieve memories from the past, okay, or before a particular trauma or injury to the brain. And we can talk about anterograde amnesia, which refers to an inability to form new long-term explicit memories, right? So again, retrograde amnesia means everything that happened after the event that damaged your brain and led to the amnesia, okay? Everything in the past is no longer accessible to you. Whereas anterograde amnesia means you are no longer able to form new explicit memories. Okay. Okay. So the next videos in the playlist that you guys are going to watch are about two very, very famous cases of amnesia. So the first one is the case of Henry Maliason, or HM as he's referred to in the literature. So as you'll see when you watch his video, essentially what happened to Henry is he extensively damaged, or he sustained a significant head injury that damaged his brain when he was a child, and it resulted in an intractable case of epilepsy. So he was suffering from many different seizures a day, and they were unable to control his seizures with any sort of medication. So he had very severe epilepsy, and it was significantly impacting his quality of life. And so his neurosurgeon, Dr. Scoville, was trying to think about other methods besides medication that could be utilized to treat his epilepsy. And he decided to remove Henry's hippocampus. So this had been done previously, even though brain science or cognitive neuroscience was in its infancy at that time. This is a procedure that had been done in others, but not to that extent. So for example, people had removed sections of the hippocampus and found that that successfully abated a lot of people's seizure disorders. But because Henry's epilepsy was so severe, they reasoned, or Dr. Scoville reasoned, that perhaps the entire structure should be taken out. And as you'll see in the video, the reason why why Dr. Scoville came to this decision is that the hippocampus is one of the primary producers of the neurotransmitter glutamate, which is the primary excitatory neurotransmitter in the brain. Okay. So remember, I told you guys that seizures are caused by too much excitatory activity in the brain, essentially an electrical storm of overactivity in the brain. And so the rationale was, if we remove this structure that's producing this excitatory neurotransmitter, perhaps that would end the seizures. And it did. After his hippocampus was removed, Henry eventually stopped having seizures completely. However, upon removing Henry's hippocampus, it was discovered that he could not form new explicit memories, right? So he had a very severe case of anterograde amnesia. It should be noted he did not have retrograde amnesia. So he was still able to retain all of his memories prior to the surgery in which his hippocampus was removed, but none of the experiences afterwards, events or experiences afterwards, could be retained. However, Henry's ability to form new implicit memories remained intact. Okay, so for example, Henry could learn all sorts of new skills. So you'll see that he learned very quickly how to trace a star in a mirror, which is a very difficult task, and that his performance improved over time the more he attempted to do this task. Even though he had no memory of the prior instances where he engaged in that task. So he learned all sorts of things. He learned games, various procedures, locations of objects, and so on. And he demonstrated that he had those skills, that they were retained, even though he had no memory of those learning episodes. Okay. So we see a very striking example of the role of the hippocampus in creating new explicit memories. And also that double dissociation, that you can have no explicit memory, but totally intact implicit memories in the case of HM, or Henry Maliason. Okay, Another case, so the third video that you guys are going to watch is going to talk about the case of Clive Waring, who unfortunately, as a result of contracting the herpes simplex virus, developed a very, very severe viral brain infection that resulted in complete destruction of not only his hippocampus, but also various regions of his frontal lobe. And unfortunately, as a result of that, he had global amnesia. So he had both retrograde and anterograde amnesia. And he also had difficulty with emotional regulation, which is one of the primary functions of the frontal lobes as well. And we see very, very clearly in the case of Clive Waring the dissociation, not just between implicit and explicit, but also short-term memory and long-term memory. Because the entire duration of Clive's memory is between 7 and 30 seconds. So it's completely within the confines of short-term memory, and he's not able to retain anything beyond that particular time period. And so, as his wife Deborah very eloquently explains, he sort of has this perpetual feeling of waking up or being conscious yet again because he's not able to remember anything that previously occurred. And in fact, as you'll see in the video, one of the things that they often do with patients with extensive memory problems is they have them keep a diary. Right? And so what you see if you look at Clive's diaries is he often crosses out all of the entries prior and says in very large kind of letters emphasizing statements like, I am alive, I am now totally awake, I am now truly awake or perfectly awake, because he has no prior memory of having made those entries. Right? So we see that's the dissociation between short-term memory and long-term memory, right? Because his digit span or his word span or letter span would be totally normal as compared to someone who hadn't acquired this severe infection and sustained this kind of damage. But his long-term memory or his ability to acquire explicit memories is totally absent. We also see evidence of implicit memory with Clive because he was a world-famous conductor and a very, very talented musician. And if you sit him in front of a piano or you sit him in front of an orchestra, he is still able to play the piano and engage in those activities with the same degree of skill. And he's able to learn new musical pieces and perform them beautifully, despite the fact that he has no memory of learning to play these instruments or of being a musician, or really most of his past life as a result of the retrograde amnesia is totally gone, right? But he is able to retain those skills, and they're completely unaffected by his injury or by the infection. Another case in the very early clinical literature was documented by a Swiss neurologist, and he was working with a patient with what's called Koreschoff Syndrome. So Koreschoff Syndrome is another memory disorder that typically presents in either individuals with very, very severe alcoholism, or sometimes in bariatric patients who have had some form of weight loss surgery or stomach removal surgery, and as a result of that are no longer able to absorb nutrients. So what causes Koreschoff syndrome is a deficiency in what's called thiamine, the thiamine protein, or a form of vitamin B. And essentially what results is anterograde amnesia, retrograde amnesia, and also what's called confabulation, where you essentially come up with explanations for things that are totally false in an effort to make sense of the world, right? So that's kind of beyond the scope of what we'll be talking about. But what's critical to note here is, again, this dissociation between implicit, or the fact that you can have severely damaged capacity to encode explicit memories, but you can still have intact implicit memories. So this particular Swiss neurologist introduced himself to this Koreschoff patient, and he had a pin in his hand. So he shook the patient's hand, and the pin pricked the patient. Later, even though the patient could not remember, this Swiss neurologist could not remember that they had met previously, okay, this patient refused to shake the physician's hand. And when pressed to explain why, they simply said, sometimes pins are hidden in people's hands, right? So there's an implicit sense there, perhaps as a result of classical conditioning or some kind of automatic association, that this is a behavior that should be avoided, right? Okay, so yet another example. Okay, so now I'm going to show you guys a couple of examples of experiments that have demonstrated this dissociation between implicit and explicit memory. So again, the population that was used here were Koreschoff's patients. And so they did essentially two different memory tests with these patients. So in this particular study, patients were shown incomplete pictures of objects. So they were essentially pictures where parts of the picture were erased. And they were asked, have you seen this picture before? After repeated viewings of these pictures, which is an explicit memory test, right? Because they would have to consciously recall the previous learning episode or the previous trainings they had had. And they were also asked simply to identify what is this object, right? So this is an implicit memory test because you don't necessarily have to recall the previous times you have viewed these pictures to be able to identify the object, right? So the idea is that with intact implicit memory, even though you don't remember looking at these pictures, your performance should improve because you've looked at the pictures before, right? So what they found is while the Koreschoff's patients did very poorly on the explicit memory test, their performance on the implicit memory test improved over successive days of training, even though they didn't remember the training itself. Okay, so over the course of 3 days, the patients improved without remembering previous training or exposure to the stimuli. So their ability to identify the object as an airplane improved or got faster or more efficient, and they also made fewer errors. Okay, one more experiment. So in this particular study, they looked at 3 different groups. So the group of interest were a group of participants with Koreschoff Syndrome. So these were amnesic patients. And they had 2 control groups. So in one control group, they were patients without amnesia who had alcoholism, right? So remember, Koreschoff's is essentially alcoholism-induced amnesia. So they would want to compare individuals who had also ingested a lot of alcohol or had a lot of alcohol exposure, but who were not suffering from a memory impairment. And they also had patients without amnesia, without amnesia, who had no history of alcoholism. Okay, so we have Koreschoff's patients, people without amnesia with alcoholism, and people without amnesia who had no history of alcoholism. And in this particular task, they were shown a list of words, and they were instructed to rate how pleasant the words are on a scale from 1 to 5. So this was basically a task designed to make them focus on the words, but not necessarily require them to engage in any kind of effortful processing. So what they did is they had an explicit memory test where they were told to recall as many of the previously presented words as you can. And they also had an implicit memory test. So for the implicit memory test, they would see word fragments, right? So if, for example, the word was beach, they might see B and then a blank space, and then a blank space, and then CH, right? And they would have to come up with, as quickly as they could, the answer or the letters to fill in the word, right? So again, a recall test where they have to write down as many of the previously presented words as they could remember would require explicit memory because they have to consciously recall the previous learning episode, whereas the implicit memory test, it could be any word, right? So they don't have to remember having previously recalled the words, right? But even in the absence of being able to recall the previous learning episode, it's possible that they could acquire, as a result of their prior experience, some knowledge of the words, and that should result in faster performance, right? And that's exactly what the researchers found. So both the patients without amnesia who had alcoholism and the patients without amnesia who had no history of alcoholism did far better than the amnesic patients in green on the recall test, right? So clearly the amnesic patients relative to the non-amnesic patients are doing much, much worse on the explicit memory test or the recall test. But if we look at the implicit memory test, they're basically all the same, right? So the amnesic patients aren't showing any evidence of difficulty on that implicit memory test, right? They are doing just as well at that fill in the blank task as the patients without amnesia, right? So that's yet another example of how we can have an inability to acquire explicit memories, but a totally intact ability to continue to acquire automatically processed memories or implicit memories. Okay, one final experiment. So in this particular study, what these participants, what their experience was, is they would see a blue light, and every time the blue light was presented, it was followed by the sound of a very loud boat horn. And those of you who haven't ever been on a boat before or a ship before and haven't heard one, a boat horn is extremely loud and it's very jarring. It's very startling, right? So every time they saw the blue light, it would be followed by this very loud, startling noise, whereas other colors of lights wouldn't be followed by that, right? So this is an example, again, of a classically conditioned association. The blue light alerts people that they're going to hear a very loud noise, right? So it's a classically conditioned dissociation. And like I said, classically conditioned dissociation are examples of implicit memories, right? So presumably, if we go back to our diagram, right, an individual who has sustained damage to the hippocampus but still has an intact amygdala and basal ganglia won't remember having seen the blue light before, okay, but they should still show conditioned fear, okay, because the regions of the brain associated with the acquisition of implicit memories are still present. Similarly, an individual who has sustained damage to the amygdala but not the hippocampus will consciously remember the previous episode in which they learned to associate a blue light with a loud boat horn, right? So they'll remember their previous experience with that association, but they won't be able to show the conditioned fear response that is processed in the hippocampus. And that's exactly what the researchers found. So the SMO46 patient, right, has an intact hippocampus but damage to the amygdala, whereas patient WC1606 has an intact amygdala but no hippocampus, right? So we see if we look at the fear response, which was measured using basically skin conductance, or what's called the galvanic skin response, which basically just measures perspiration, which is a physiological measure of fear. Right? So we see that for as far as the fear response goes, right, the patient 46 shows no fear response as evidenced by their SCR, right? But if we look at the explicit memory test, that response is totally intact, right? So they're able to recall if they're asked the question, what happens when there's a blue light, right? 46 can say, oh, whenever there's a blue light, a boat horn sounds, right? Even though they don't show any evidence of fear conditioning, right? But the inverse is true of those that have a hippocampus or have an amygdala but no hippocampus, right? So they show a fairly strong fear conditioning response here in their amygdala, right? But when they're asked what happens when there's a blue light, right, they don't remember. So they don't remember to say whenever there's a blue light, a boat horn sounds. Okay? All right. So collectively, all of these experiments and all of these cases of HM and Clive Waring demonstrate that there are different regions of the brain that are responsible for processing memories that are acquired automatically or implicit memories, and those that are acquired effortfully or explicit memories. Okay, so we have a clear double dissociation here. Effortful memories are acquired, are processed through the hippocampus, whereas implicit memories are processed through the amygdala and basal ganglia. Okay? All right, so this is my only video for this particular module. So after you have watched this one and watched the video on HM and Clive Waring, that is it for this week. So I hope you guys all take care, and I will see you in my next video.